Hello and welcome back to Ask Endocrinology channel. I am Dr. Grace and with me is Dr. Hope.
Good. Hello, how are you doing today?
Yes, so we are happy to be here once again to talk about high cholesterol. High cholesterol could be a problem, and that is why we want to make sure that we are aware of it and we know what to do when we have high cholesterol. If you are new to this channel, we encourage you to subscribe, like, and share with your friends. This is a platform where we just talk about our health and how to stay healthy. Remember, the more you know, the better you are. So, Dr. Hope, what exactly is this cholesterol and could it be a problem?
Okay, so cholesterol is a waxy substance in the blood that is needed for to form healthy cells, but in abundance, too much, it can form um, fatty accumulation and block the blood vessels. So, in that way, it can be dangerous and lead to heart attacks and strokes. So there are different types of cholesterol. There is the good cholesterol, which is called HDL, and the bad cholesterol, which is LDL. And there are also triglycerides, which are formed from VLDL. So our aim is to increase the good cholesterol, which is the HDL, and lower the bad cholesterol, which is the LDL and triglycerides.
Yeah, yeah. That's very true. And where can we get this cholesterol? Is it like in all our foods or how do I know that, okay, I'm eating low cholesterol?
Right. So cholesterol can be increased from a few things. One, yes, in the diet, high cholesterol foods such as meat, like fatty meats, like steak, uh, very not lean meats, steak, even things like goat meat, like other things that are very high in cholesterol. Mostly meats, eggs are very high in cholesterol. So the diet definitely is one source. A lack of exercise is another way that our cholesterol can be increased. Um, and there are also medical problems that put us at increased risk of high cholesterol. That includes diabetes, but hypothyroidism, an underactive thyroid, can increase the cholesterol. Disorders like chronic kidney disease and even HIV can increase these cholesterol levels as well.
Yeah, that's true. And I know that also the liver can also produce this cholesterol even despite what we eat. Our body itself produces it because cholesterol is not just bad, it's also important for producing our hormones and helping us in many of the cell membrane level, they said, you
That's
know.
right.
Yeah, so it's not that cholesterol itself is a bad thing to have, but it's just some excess of some type of cholesterol could be bad, and this could lead to major problem that we don't want it to lead to. Can you talk about what complications people can have when they have too much of this cholesterol in their blood?
Okay, so too much of the LDL cholesterol can lead to heart attacks and strokes. So even so, some of the manifestations of that are early manifestations, may be chest pain. So some people may develop chest pain, which could be a sign of high cholesterol in the blood, and then eventually that can lead to heart attack. So they can have maybe angina, which is like short bouts of chest pain, but the vessels are not fully blocked. But then eventually the vessels can be completely blocked, and that can lead to a heart attack. The other risks that that are due to high cholesterol are patients can develop strokes. So strokes really develops from decreased blood flow to the brain, right?
Yeah.
So that could be from blocking vessels that are in the brain or that lead to the brain. So definitely, those are increased risks. that can develop or increase complications that develop from very high cholesterol. So the triglycerides can
Mm-hmm.
also be elevated. And before heart attacks and strokes, it can just lead to problems with the pancreas. So, pancreatitis, inflammation of the pancreas can be a sign. So, abdominal pain may be a manifestation of a
Yeah.
high triglyceride level as well.
And the funny thing is that at the early onset, people don't know they have the
That's
symptoms
right.
because you will
That's right.
just believe in your life, you don't even know your cholesterol level is high, and until it get checked up. But some people who have the genetic predisposition, they can
Yeah.
develop some signs that make you know that there is high cholesterol in your blood. And some of these signs are the corneal ring. Around your high level, there is a ring, cholesterol ring, which we call corneal arcus. And then there's xanthoma, which is cholesterol plaguing around your skin level. Some around the eyes and some at their tendons, especially at the back of their feet. So these are signs for people who usually have inherited form. But for those who don't have inherited form, they may not even know they have this disease.
Yeah.
Yeah, and that's why it's important, when you go to see your primary care doctor to have your blood work check. So usually when any patient comes to the hospital, there are things we check to confirm the diagnosis that you have high cholesterol or not. So one of the things is taking history. You talk to us, what is going on, any family history of cholesterol, and then we examine you. We look for all those signs. We check your blood work. We check for you something in bracket or in full. We call it the lipid panel, which contains everything Dr. Hope has just mentioned. The LDL, the triglyceride level, the total cholesterol level, and the like. And then we interpret the results.
Yeah. So one of the things that you touched on, Grace, was the history. So I just wanted to stress something that we didn't actually stress, that smoking in your history increases your cholesterol. So if you have a
Absolutely.
history of smoking or if you're currently smoking, it definitely puts you at higher risk of having a high cholesterol, and also lack of exercise. So like a sedentary lifestyle, not walking, not exercising,
Yeah,
sitting around, that also increases your risk of high cholesterol. So those are some of the things that your healthcare provider might identify in your history that may point, or they may realize that you're at higher risk of having a high cholesterol.
absolutely. And if all these things and you notice or your doctor confirmed that you have high cholesterol, is this something treatable, Doctor Hope?
Sure, sure. So first of all, how does the doctor confirm it? It's confirmed with blood tests. So they draw the blood, and they usually would do a cholesterol panel, which actually breaks down the cholesterol into those different types of
Yeah,
cholesterol. So the HDL, they'll measure the HDL, the LDL, which is the good cholesterol, HDL, the LDL, which is the bad cholesterol, and then the triglycerides or the VLDL as well. So they'll measure all of that with a simple blood test, and that can give them it will let them know what your cholesterol levels are. And once they see that your cholesterol level is high, then there are treatments for that. The most common treatment is statins. So statins are a group of medications that have been known to decrease cholesterol levels. um, some patients are very high risk, so statins are recommended, and those patients include diabetics, or
yes.
even without checking the cholesterol necessarily. Those patients are at such a high risk that it's recommended that they're started on a statin. And patients, of course, who've had a heart attack already should be on statins.
And ways to prevent this, or even when you are diagnosed you have it. If you smoke, it's always advisable to quit smoking. It could just make it
Yes,
worse. And if you drink a lot of alcohol, excess alcohol is not good.
that's right.
It can
Yeah,
also make it worse. And the
that's
the
right.
the way this cholesterol works is that it causes a plaque. It clog up your arterial vessels, your blood vessels, and it's like you driving on the highway and there is a big truck blocking the road. So it can just block the
Yeah.
road, and it can cause accidents. It can make one's heart stop. So you don't want to have your vessels clog up. That's how I explain it to my patients sometimes, for them to
Mm,
understand what do they mean by I have high cholesterol. You have something that can clog up your vessels. So the
mm,
ways to prevent it is the key, and
mm.
do do exercise. Don't just sit down in one position, move around. Eat low fat diet, fat diet. And then when you buy food or go to the store, look at the nutrition label. They will tell you high saturated fats, low saturated fat, all those. So you don't want to take food that has very high saturated fats. They are not good. So you want something that is not highly saturated, and do exercise.
Yeah.
Yeah.
So that's one of the things, just people might be interested in knowing, like, okay, uh specifically, how much
Yeah.
exercise do I do? So the recommendation is actually to do at least 30 minutes of some aerobic exercise more than 5 times a week. So 150 minutes a week, right? So 5
Yes.
times 3, right? 150 minutes a week of some type of aerobic exercise. And the most common form of that is just walking.
Yeah.
But some people like to run, some people like to do bike riding. So those kinds of activities are considered, the recommended activities to increase your metabolism and also help decrease your risk of high cholesterol. And then the alcohol, some people say, oh,
Yeah.
I drink some alcohol, 1 glass of wine a day. That usually doesn't do it. It's usually excessive alcohol or
Alcohol
very
use.
increased levels of alcohol drinking. And smoking, even one cigarette a day,
Yeah.
puts you at increased risk. So I don't recommend smoking at all. I recommend
Yeah.
stopping it
Yeah.
completely.
And some with the genes, no matter everything you do, because it's inherited, you just have to be on medications and avoid your lifestyle, avoid those unhealthy food, and you can all lead a healthy lifestyle. So we will hold it up here, and we'll continue next week or in our next video for other topics. If you have any question, comments, please kindly put below in the comment section. Let us know your thoughts and how we can be of help. Remember that the more you know, the better
The
you
better
are.
you are. Thank
Right.
you.
Thank you
And
for
please,
joining us today. Yeah.
please subscribe.
Yes, please subscribe.